all the biological changes, conversion, it happens in the system for digestion, metabolism, and producing secondary metabolites. These are secondary metabolites in the system, which is instrumental for that neurological aspect or any biochemical aspect. Without a microbiome, we can say that in the system nothing is happening. So in this aspect, when the problem comes, it should be assessed that what is the changes in the system, microbial changes, microbiome load changes. So then only that the problem of immunology, it first starts with the inflammation and immunology, extrinsic pathway and intrinsic pathway, how it's involved on that, basically the immunological aspect compromise, then the allergy, it is influencing with the allergy, either it is a running nose or it is a kind of certain the allergy in the skin, it causes the fever and inflammation. These are the prima phase of that reorganizing or load of that the microbiome, it is not in normal. That is the first component in Ayurveda. We should see that I am not with that much of that the Ayurvedic component, the formula or that what the procedural aspect, you all the practitioner, you know very well. But while seeing the data and the science, what it sounds and what the secondary metabolite it produces, I can quote some of that the example here. In simple form, LPS, if entered into the system, then that inflammation it starts. It is managed by the GLP-1. This is the first component, and subsequently the insulin resistance it happens. These are the two components in the system to make that the cell dysfunction. This cell dysfunction need to be corrected from the basic level. What is the cause for the problem? Because of the GLP level comes down. GLP level comes down. These are all the inflammation would go major level. The cell function would not happen normally. So we need to see that what is the cause for the problem, for which short chain fatty acid like acetate, propionate, butyrate. The butyrate are that very serious component for that influencing or maintaining the regulation of the GLP-1. The GLP-1, if it is maintained well, insulin sensitivity pakka hai. Whenever that insulin resistance it starts, GLP-1 it comes down. These are the two causes we have to be very serious in practice and understanding that the health system. So GLP-1 and insulin resistance, it is not that the case of only metabolic disorder. It is everywhere it is involved. In that the neurological disorder or in the cardiological disorder, in the renal failure, even in that the fatty liver, the insulin resistance is a very serious concern. We need to take it in account. Insulin resistance, in simple form, I can say that insulin is there, but the cell is not functioning and accepting that of the insulin. This is the problem. So while insulin is there, and even externally influence the insulin also, it doesn't mean that the cell consume the insulin. This is a very serious concern in the practice to understand that where is the problem. While insulin, it is there, again you are loading that insulin for that the therapy of that the hyperglycemia, then the patient what hyperinsulinemia it happens. So basic the challenge here is studying insulin sensitivity and understanding insulin resistance. Why insulin resistance itna level it is there, inflammation is major level, then it comes at the seizure, it comes at the fibrosis, it comes into that all dysfunction of the cell. the neurological activity or the blood pressure, cholesterol, SARA component would go down. Mitochondria level goes down. So the GLP-1, it is a very simple component, the short chain fatty acid. What the materials we provide that as a medium for microbiome, which provide the short chain fatty acid, mainly oligosaccharide, is an important source for that microbiome to convert that oligosaccharide into the short chain fatty acid. This butyrate level it is maintained. Then it influences that GLP-1. Your problem is that addressed. Then that the insulin resistance is addressed. So without addressing the cause for the problem, addressing that the therapy, it is not going to happen. This is a very simple message I want to share with our colleagues. So while we see that the patient in rational, ethical manner, we should understand that what is the individual microbiome and how that the toxin can be removed first, and reloading of the microbiome to maintain that hemostasis. Dysbiosis should be removed. Hemostasis should be maintained, for which how that the microbiome load can be maintained. It is either Corynebacterium, Bifidobacterium, Bacteroides, Viremella, Faecalibacterium. All these are the microbiomes are very serious concern in normal vegetables and fruits. It has that the several and loaded bunch. And how that the component of medium of that beans, different bean source with the oligosaccharide. So both the component slowly replaces, the system become normal. So this is a international webinar on microbiome for healthy aging in the level of the pediatrics as well as in the geriatric. In the middle age, there is a manageable thing, but in that the geriatric, it is a very challenging component. That's I appreciate that the organizing committee and the director, Professor Prajapati, taking up this healthy aging, microbiome role in healthy aging. The people want to have that the wonderful cognition, the best performance, and every day that it is excellent activity I need to do. But unless otherwise, the load of the microbiome is not maintained, the cognition of that the individual will not that efficient as expected, as per your wish of that the individual. The same thing it is applicable to that the physiology to the pathology. So with this that the few word, the meeting is well organized with that the different the speakers with that their expertise. Professor Dennis John, Director NICM, WSC Australia. There's a Western Sydney University, Australia. Dr. Prashant, Dr. Sarah Alizin from that Australia. Pramod Yadav from that the Parent Institute, Shivakumar Harthi, and Shivani Gulati, Giltia. So, Professor Rajagopal, it all gives that different flavor and fragrance potential of that the objective of the program Microbiome for Healthy Aging. Thank you for that my presence with that the Professor Prajapati inviting me for this event. Really, I enjoyed that today with present with all the colleagues and seeing of very interesting the concept and principle important for the practice for the ailment of that the challenging people who reach you for that the therapy. With this, I conclude with the thanks to the organizing committee and the director, sir.
Thank you. Thank you. Thank you very much, sir, for your inspiring words and highlighting the importance of microbiome in the gut as well as in the human health. Thank you very much, sir. Despite of your schedules, you have spared a few minutes with us. A special thanks to that. And now I invite our Director, All India Institute of Ayurveda, Professor Pradeep Kumar Prajapati, a renowned Ayurvedic scholar and researcher and administrator too, with vast experience in the field of Rasashastra and Bhaishajya Kalpana. This particular field is representing the pharmaceuticals in Ayurveda, and he significantly contributed in the education, research, and policy developments. He was head of the department. He was vice chancellor to Rajasthan Ayurveda University too, and now he is director of our institute, leading our institute to greater heights. And I request him to say a few words on the occasion of this webinar. Professor Prajapati, sir, please.
Thank you, Dr. Rajgopal. Good morning to everyone. And on this inaugural session, chief guest of this inaugural session, Professor Ravi Chandranji, Vice Chancellor Dipsaru, and Professor Janice Changji, Director and ICM Western Sydney University, Australia, Dr. Deep Jyoti Bhuyan, Dr. Prashant Reddy, Dr. Sara Aladin, Dr. Pramod Yadav, Dr. Shiv Kumar Harshi, and our Dean, Professor Jonas ji, and Dean Delhi University, our Professor Manjusa ji. Today's guest, Dr. Alok Gupta ji, is also in IIT professor and looking after the chemistry department of whole what is going on. They basically is engaging in the rural development, how to cope up these situations and how to give the benefit to the farmers and rural persons. So I welcome all of you, sir. Thank you for coming here first, Rishi sir, because being a short notice, you accepted my invitation. Thank you on giving the so much insightful of the topic, because I'm searching that who will give the insight. So at once I remember your name and you give the very insightful objective of this webinar, because microbiome for healthy aging is very important nowadays. We see the maximum old persons are the, as we are going to be aged, the whole GI tract is violated with the bad bacteria. So more than 5 trillion bacteria are in our intestine, and our therapy, especially Ayurveda, mainly focus on the GIT purification by the incorporation of woman and Virachan in up to the age of adult. And in old age, generally we are focusing on the Vasti. So whole intestine is purified by these methods, and now with the association with the research projects with ILBS, we have established that these methods are beneficial for all. So they have changed the atmosphere environment of the GI tract as a whole, with increase the number of the good bacteria, reduce the number of bad bacteria. So, and there are so many regimes are explained in our classics for these type of the diseases and these type of the conditions. Generally, whole Rasayana therapy focus on this kalpas, different type of kalpa, like Rason kalpa, Bala kalpa, Bhallatak kalpa, Shilajit kalpa, Satabri kalpa, Arjun kalpa, and Asugandha kalpa. The Cheer kalpanas are used for that. And as you know, though milk and milk products are banned nowadays for many of the practitioners, because the quality of the milk. If we find the original milk from our desi cows, regional cows, then it is very helpful for the maintaining the gut microbiome of ourselves. So for that, in olden days, all the rishis, all the families are using this milk throughout their life with the help of either jaggery with the gur or salt with the milk, etc. These are the different practices in the different region of the India, and they maintain their life with healthy lifestyle. So I think this is the main focus of the present era, how to maintain the microbiome of gut. It by incorporating probiotics or by incorporating the sese in our gut is sufficient, I think it is not sufficient. So maintain the Sansarjan karma. Pathya kalpana is very much important nowadays. Better dietic habits. We have changed so much dietic habits in our daily routine life, and that creates a problem for us because it depends upon the regional and seasonal variation. So, region-wise dietic lifestyle is explained in everywhere. So that lifestyle of the Australia is different, of the India is different. UK is different, Africa is different, and America is different. So that lifestyle, especially for the food habits, local area should be searched and local regime should be followed for their lifestyle, then it will be helpful for all of us. So that is the probably we think in that direction, and certainly we need some research work also, sir, in collaboration with you, sir, and with you, sir, also, because nowadays it is important to produce the evidence-based research proposals, evidence-based data. So it needs more concentration on that particular issue. So I think in the future we are planning the same with the help of the Kayakikisa and Panchakarma especially, because they are mainly focusing on these particular issues. So after each process, please collect the fecal material, urine, and food material for the analysis of this particular microbiome. Then you find that in our thinking, it is we find them. It is helpful for us, and we just certainly we generate some evidence with generate data so that public can accept as such in scientific era. It is mandatory for all of us. So thank you of all of you to joining this, especially thanks Dr. Dennis Changji and Dilip Ghosji for taking this MOU in right direction in the leaders and in the collaboration with Dr. Rajgopala, because we know you all give so much heights to this particular MOU, and we are developing such a wonderful documentation by publishing the book and publishing the research articles. So it should be continued in future also. Probably we are thinking this some educational program in Sydney also, because we are planning some diploma courses and certificate courses and degree courses also with our government. So if government allows, then we will go there and establish some degree courses for the betterment of this science. By incorporation of the traditional and folklore medicines, traditional science of your country also in that, because without which it could not be possible to accept by the people. So that should be mandatory. 80% or 30% should be from the Ayurveda side, and 30% from the your folklore medicine and traditional system. That should be incorporated in this, because regional and seasonal variation impacts more on healthy persons. So that should be incorporated, and we prepare the such type of syllabus that should be accepted as a whole. So thank you for joining, and I am also thankful to all the speakers who are going to deliver the lecture, their topic in such a way that is very fruitful, I think. How there are so many persons are joining this webinar, probably more than 100 and 120. Yes, we are seeing that. So I am thankful to all of you who are joining online, all the scholars, all the teacher faculty members, and our this particular webinar. So thank you very much to all of you. We will hope that we will do something better for the younger generations. Thank you very much.
Thank you very much, sir, for your inspiring words and explaining the future course of action from both the institutes under this MOU. And now it's my pleasure to invite Professor Dennis Chan, the Director of National Institute of Complementary Medicine, Health Research Institute under Western Sydney University. Professor Chang is basically a pharmacologist and a researcher, eminent researcher with extensive experience in integrative medicine, pharmacology, and clinical research. His research mainly focuses on clinical and pharmacological studies of herbal and complementary medicine interventions. He has led several significant clinical trials evaluating the effect of herbal medicine, yoga, Tai Chi in conditions such as dementia, coronary heart disease, metabolic syndrome, type 2 diabetes, etc. Professor Chang has also conducted extensive laboratory-based pharmacological studies exploring the mechanism and bioavailability of natural medicines, particularly bush medicine, the traditional medicine of Australia, with the neuro and cardioprotective potentials. The NICM Health Research Institute, Western Sydney University, proudly hosts the Ayurveda Chair of Government of India, Ministry of Ayush, established in the year 2023. And I welcome Professor Chang for his address in this webinar. Professor Chang, please.
Yeah, thank you for the kind introduction, Dr. Rajagopalan. So, Professor Preeti Kumar Prajapati, I'm Director of All India Institute of Ayurveda. Professor Ravi Chandran, I'm the Vice Chancellor, Delhi Pharmaceutical Science and Research University. Distinguished speakers, colleagues, and participants, namaste and good morning. Obviously, it's a good afternoon here in Australia. It is a great pleasure and honor to once again join our colleagues in India for this important international webinar. So on behalf of my university and also the National Institute for Complementary Medicine, NICM, I do want to extend my sincere appreciation to Professor Prajapati and his team at AIIA for convening today's event. As we know that our collaboration between AIIA and NICM has grown from strength to strength ever since our first MOU signed in 2019, I believe. And since then, we have actually co-hosted several international events, including these new joint research webinars, and also, more importantly, the establishment of the Ayush Academic Chair in Ayurveda at Western Sydney University. And through these initiatives, and our institute laid a very solid foundation for advancing the scientific validation, the global visibility, and evidence-based integration of Ayurveda within the modern healthcare systems. And obviously, the excellent work of our Ayush Chair, Dr. Rajagopalan at NICM in 2024 has further strengthened this link between the two countries and two institutions, helping to facilitate joint research projects, student exchanges, and knowledge translation that align really well with the goals of both institutes and AIIA and NICM. So obviously today's theme is a microbiome for healthy aging, sits perfectly at the intersection of ancient wisdom and also the cutting edge science. And so the modern biomedical research continue to review the benefits and the influence of the gut microbiome on immunity, on metabolism, brain health, and longevity. At the same time, Ayurveda have a long history and really long recognized the central role of digestion and internal balance in maintaining the vitality and delaying aging. So bridging these two paradigms together through collaborative scientific research on gut microbiota modulation, postbiotics, and traditional herbal formulation offers a really powerful opportunity for us to develop next generation of personalized, holistic approach to healthy aging. So in today's webinar, we will hear from NICM researchers, including Dr. Deep Boyan and Sarah Aladdin, who will share their research investigating the microbiota, gut and brain axis, and also the effects of the postbiotics on cancer and the cognitive function, which we were quite excited to have those research programs at NICM. Meanwhile, speaker from AIIA will showcase your research to advance clinical and mechanistic study on that illustrate Ayurveda's contribution to immune metabolic balance and neuroprotection and longevity as well. So through these efforts, really demonstrate how transdisciplinary collaboration between Ayurveda and modern bioscience can really generate innovation that benefit not only patient but also global healthcare systems, as well as the sustainable development of the traditional medicine industry as well, which is booming in both countries. And through the initiative like this webinar, of a continuing cooperation between AIIA and NICM under the new WHO Traditional Medicine Strategy 2024 to 2034, we aim to expand our collaborative research, training, and policy dialogues that can guide the safe, effective, and sustainable integration of Ayurveda, as well as other medical traditional medical systems into broader landscape of global health. So I would like to congratulate the local team to organize this exciting webinar, curating such an excellent lineup of the speakers and topics, and to thank all the participants for joining this important exchange of knowledge. So let's make this event another step forward on our shared journey towards a credible, connected, and compassionate global health future. So I also want to wish the webinar every success and thank you.
Thank you very much, Professor Dennis, for your inspiring words and sharing our Ayurveda chat experiences too. Thank you very much. Now we'll move on to our scientific presentations. And there are 5 presentations today, 2 from National Institute of Complementary Medicine Australia and 3 from our side, All Indian Institute of Ayurveda, wherein it covers Ayurveda, the contemporary research in gut microbiome, as well as yoga in healthy aging. To start with, the first lecture will be from Professor Dr. Deep Jyoti Bhuyan. He is from Western City University, Research Support Program Fellow, International Engagement Coordinator 2 in the Western City University for the higher degree research activities. And Dr. Bhuyan has established maybe first of its kind, the Gut Biotic Lab in NICM, that is National Institute of Complementary Medicine, exploring gut microbial modality, metabolites, and their impact on human health. His research focuses on postbiotics and phytochemicals from Australian native plants for cancer and infectious diseases therapies. He plays a key role in strengthening India-Australia research collaborations and mentoring over 40 higher degree research students. A graduate from India and a PhD from University of Newcastle, Australia, he has extensive international research experience, numerous publications, and active engagement in science communications and advisory committees. Dr. Bhuyan, a good friend of me, please come on and present your deliberation on the topic postbiotic for gut health and cancer therapy. Dr. Bhuyan, please.
Thank you so much, Dr. Rajagopala, for the very long and kind introduction. And I think I have 15 minutes. So I'll start sharing my screen.
Yeah, please.
Can you all see my screen?
It's coming up, not yet.
Is it loading or?
Yeah, now it has come. The first slide is on the screen.
Yes, okay, great. Is it a full screen or you can see some text on the side?
It's a full screen. It's a full screen.
Okay, great. Thank you. Thank you so much. These technical issues, I was just, preparing myself. Thank you so much for the kind invitation to Professor Prajapati, the Director of All India Institute of Ayurveda, and Dr. Rajagopala, of course. And thank you so much, Professor Chandran, for the introduction to the topic, and as well as Professor Jonas. So before I begin, I would actually like to start by acknowledging the traditional custodians of the land on which we are meeting today. And I want to pay my respect to the elders past, present, and emerging. All right, as Dr. Rajagopala suggested, today I'll be talking about our research in the area of postbiotics, which are the gut microbial metabolites. And I'll be talking specifically about what we have done in relation to cancer therapy when it comes to postbiotics, and the reason why, several reasons actually, why we are looking at postbiotics when it comes to the microbiome research. So just to give you a little bit of background, just about 94% of Indians actually don't eat enough the recommended vegetables, and same goes for Australians as well. Even though we are slightly better, about 92% of Australians don't meet their daily recommended vegetable intake, and in turn, basically, there's a direct correlation of poor nutrition and the overall health burden. So India spends about, I'm just trying to, going to attempt telling you the figure. It's about 900,000 crores of Indian rupees on its healthcare system. It spent that much in 2022, and 50% of that spending was out of pocket. So you can imagine the level of the health burden that India has because of of course lifestyle and poor nutrition. And similarly, Australia spends about 195 billion every year on its healthcare system. So there's that direct link, as I said, and there's definitely room to improve nutrition, and so that we can reduce the overall health burden globally. So with that idea in mind, we started this particular research group back in 2021 at NICM Research Institute, Western Sydney University. This is a quote from Louis Pasteur, who is a microbiologist and who basically discovered pasteurization. I'm a microbiologist by trade, but I have expertise in cancer research. So, and he said that the role of infinitely small in nature is infinitely large, and the best example would be COVID, because how COVID basically made us stop like everything that was happening back in 2019 for a few years, and that is just because of a very small virus that dominated the world. So the role of microbiology is massive, and now modern science is realizing that through the research on microbiome. I will ask you a question. I want you to keep the answer in your mind. So when I say what percentage of our body is bacteria, what does come to your mind? So pick an option, and I'll tell you the answer in the next slide. So it turns out about 57% of us, so when it comes to the genome, is bacterial genome, and about 43% of us, 43% of our body is actually human cells. So in terms of numbers, so that you can see that here that the role of the microbiome in general, including the gut microbiome. When we talk about microbiome, we're talking about microbiome of that is present everywhere, including our skin. But the gut microbiome is predominantly the microbial communities that are present in the gut. And today we'll be discussing more about the gut microbiome rather than the overall microbiome. All right. So the health advice is quite simple, right? So when you go to your doctor, the doctor usually, to keep yourself healthy, will ask you to do 3 things together. So you need to eat well, you need to sleep well, you need to exercise daily, right? But what happens is that sometimes, even if you're doing all these things together, or like to the point, you are not going to get the most benefit out of your life. So your health is probably not optimal, even though you're doing all these things, to the point. And we think there's a missing link there, and we think it's because of the microbiome, or specifically the gut microbiome. I'll tell you why. So our idea of conceptualizing this research group began with this particular quote from Hippocrates, who basically said that all disease begins in the gut, and we believe that our health begins in the gut. And we think that every poo, like every fecal sample, has a story to tell, and we can tell a lot about someone or someone's health just by analyzing their fecal sample. So this is where our scientific curiosities began. So as I said previously, I'm a cancer researcher with an expertise in microbiology. So I decided to build this group to look at those two things together, and also nutrition. How does fruits and vegetable and Australian native fruits and vegetables specifically come into that picture, and how do they contribute to the microbiome modulation as well as to cancer therapy. So the work that I am going to present today is all the work that my students have done, and this is my research group, and these are my amazing students. So I would like to give them full credit for the work that I'll be presenting today, especially the data. So as I said, microbiome is quite important because, we have about trillions of microorganisms living in our gut. And surprisingly enough, it is now considered a separate organ in the body. So, it is considered an invisible organism because of its significance in health. It is now categorized as a separate organ in the body. And when it comes to food and nutrition, so for example, we talk about antioxidants. About 90 to 95% of the antioxidants that we get from our food is metabolized by the human gut, by the gut microbiota. So you can see that our body can only absorb about 5 to 10%, and remaining 90 to 95%, if you do not have a good microbiome, you're not going to get the most benefit out of your fruits and vegetables. All right. Having said that, I think our guest of honor previously mentioned, how we need to modulate the microbiome. But having said that, modulation of the microbiome is extremely hard. So there are so many different factors, both genetic as well as epigenetic factors can contribute to how your microbiome is, as well as the fact that the microbiome is a dynamic environment. So if you are analyzing your microbiome today versus you're doing it after a week, you will be able to see quite a lot of difference between those two data points. So, as a dynamic environment, it is very difficult to modulate it and as well as to keep it healthy for a longer duration of time. That is why we think the idea of postbiotics might be helpful in this case. So when I talk about postbiotics, I'm essentially talking about the microbial metabolites that are produced in the gut when we eat any kind of food. So your postbiotics can be good or bad depending on the type of food that you eat. If you're eating a very high fiber diet, or a diet that is rich in plant sources as well as rich in fiber, you're going to produce some good postbiotics, including the short-chain fatty acids that our guest of honor previously mentioned. So the concept of postbiotics is relatively new, and there is a lot of ambiguity when it comes to the definition itself, because in some cases, even dead probiotic bacteria are considered postbiotics. But from our research point of view, we think that the metabolites, the secondary metabolites produced by the microbiome, are probably more appropriate as postbiotics, because what we have seen through our research as well as research from different sources, that these are the molecules that are conferring all the health benefits that you can see from your food, from your probiotic food, or from your fibrous food. So through short-chain fatty acids, through things like NICM, bacteriocins, and things like that. So I wrote this particular article for our news channel in Australia a couple of years ago, informing people what postbiotics are. And the same thing I did with BBC Brazil as well, because as I said, the concept of postbiotics is quite new. And there was an article in the Indian Express as well, where we talked about how postbiotics can help fight cancer cells based on our research so far. So there are a couple of reasons why we are looking at the postbiotics, and this all started when my master's student, now a PhD student of mine, Kayla, started her master's back in 2021, and we started investigating the literature in terms of what are the molecules that are produced by the microbiome, i.e. the postbiotics, that can be helpful in cancer therapy. And we found quite a lot of them, actually, quite a number of them. And we found that there was a clear pattern. So basically, all these postbiotics, including short-chain fatty acids, NICM, butyrate is a type of short-chain fatty acid, and urolitins and things like that, they were able to induce apoptosis in cancer cells, which is a very desirable trait for any kind of cancer drug development. And we are quite happy to see that in the literature. And that's when we started our expedition with postbiotics. So this takes me to one of our students' work. So you can see here, this is Radwa. She has recently finished her PhD with me, and she was studying how we can use postbiotics like short-chain fatty acids in gastric cancer therapy, especially gastric adenocarcinoma. And these are some of the papers she has published through her during her PhD. And you can see here, and we were also invited to present this work in Germany a couple of years ago. And you can see here, these are flow cytometry figures. So I put them because they look quite nice, as well as they should tell you a story. So you can see here, when we combine short-chain fatty acids like APB, that is acetate, propionate, and butyrate, with drugs like dexamethasone, which is an immunomodulatory drug used in cancer therapy. So it was able to improve the level of apoptosis in the cells. And we studied the molecular mechanisms and the signaling pathways that were impacted through this combination. And we found that this particular combination of short-chain fatty acid and dexamethasone was quite a significant, was significantly better compared to the short-chain fatty acids alone or dexamethasone alone. So basically, we developed a combination therapy where we were able to show that the combination was more significant in terms of controlling or killing the gastric cancer cells than the monotherapies. And same goes for the other section here, where we combine just butyrate with the drug dexamethasone, and we found that the combination was able to induce apoptosis in gastric adenocarcinoma cells, which was quite a promising finding, and we were able to publish that work in the form of 3 different research papers. This is another work led by my PhD student, Ahmad. Ahmad also has recently submitted his thesis, and what he investigated, so he investigated short-chain fatty acids along with other metabolites like NICM, which is a bacteriocin produced by Lactococcus lactis, which is a probiotic bacteria, as well as urolithin B, which is an allergic acid metabolite. So when we eat fruits like pomegranate, our gut microbiota metabolize that to produce urolithin B. So what we found is that these 2 metabolites were quite active against human lymphoma cell lines. And when we combine those two metabolites with standard drug like vincristine, which is a very common drug in lymphoma, it was able to upregulate a lot of signaling pathways that were able to inhibit the growth of the lymphoma cells in the lab conditions. And as you can see from the flow cytometry diagram here, it was able to induce more apoptosis in the lymphoma cells compared to the monotherapies. So through these research, we were able to develop a number of combinations with gut microbial metabolites as well as standard chemotherapy to combat things like gastric adenocarcinoma and human lymphoma. So our philosophy is quite simple. We think that there is no point of reinventing the wheel. So there has been a lot of resources put in to develop anti-cancer drugs like vincristine and dexamethasone and doxorubicin. And to reinvent the wheel, we don't have that kind of resources. It basically takes billions of dollars to develop an anti-cancer drug. Our philosophy is that what if we use microbial metabolites to improve the efficacy of already existing standard chemotherapy so that people can have better health outcome. Same thing here. We also looked at breast adenocarcinoma cells, and we found that short-chain fatty acids like sodium butyrate was able to modulate some key pathways in the MCF7 cells, which is the breast adenocarcinoma cell, and other metabolites like NICM and inosine were also able to influence cell cycle related processes in the MCF7 cells. So Kayla is currently continuing her work as a PhD student, where she's combining these metabolites with different types of standard chemotherapy as well as immunotherapy against breast adenocarcinoma. And we are also trying to understand what kind of impact these metabolites and their combinations have on the microRNA expression levels of breast adenocarcinoma cells. In terms of gut health research, we have done some work related to probiotic as well as prebiotic formulation. So we had this particular project with an industry partner in Australia, where we looked at a dairy formulation and trying to understand how the dairy formulation impact the pathogenic and probiotic gut bacteria, as well as what are its effects on the human coronavirus 229E. This research was done during the COVID time. So that time COVID-related research was quite trendy, and we were able to analyze we were able to do our experiments on human coronavirus 229E, and the results were quite fascinating. We found that the dairy formulation was able to inhibit the pathogens like E. coli, whereas it was quite good at improving the growth of probiotic gut bacteria. And similarly, what we have found through Radwa's research is that when you use short-chain fatty acids like butyrate, it improves the number and the growth of human intestinal cells. And that is quite obvious because short-chain fatty acids, especially butyrate, it serves as the primary energy source for colonocytes in our gut. So that makes sense that it was able to improve the growth of human intestinal epithelial cells, but at the same time, it was actually killing the gastric adenocarcinoma cells. So it is quite selective when it comes to its activity. So yeah, this is what some of our highlights are. As I said, we combine short-chain fatty acids with drugs like dexamethasone and doxorubicin, as well as a number of other chemotherapy. And we're currently writing a manuscript where we looked at 3 different chemotherapy in combination, along with short-chain fatty acid combination, and how that impacts the gastric adenocarcinoma cells. And the results are quite positive so far, and we are hoping to take this forward in terms of our 3-dimensional organoid system, as well as eventual clinical trials in the future. As Dr. Rajagopala suggested, we are also doing some work in the space of Australian bush medicine. And my student Indivari, I think she's online today as well. She has done some incredible work in that space, looking at how we could use different types of Australian native fruits, especially against breast adenocarcinoma cells, and as well as to understand their chemistry and other broad spectrum bioactivity. She's currently doing her PhD, and we are trying to improve the bioavailability of these natural products from Australian bush medicine through lactic acid fermentation. So it basically joins the concept of postbiotics with bush medicine. So as I said previously, if you don't have a good gut microbiome, you're not going to get the most benefit out of your food, which means what if we can actually ferment the foods outside using the gut bacteria that we already know, and then you produce postbiotics through that fermentation process and give people that supplement in the future as so that people don't have to rely on their gut microbiome composition. Of course, this is a very conceptual stage at the moment, and we are still in the preclinical stage, but we are quite hopeful based on the data that we have so far that we will be able to do some clinical trials on these bush medicines as well as the postbiotics in the future. So as I said, we are using lactic acid bacterial fermentation as the model to ferment these fruits and vegetables to improve their bioavailability, which in turn, in theory at least, will lead to improved bioactivity and improved health outcome in the future. So key projects, currently, we are, as I said, we are trying to use Australian native plants to produce postbiotics externally. And then we are developing some 3-dimensional organoid models to understand how these postbiotics behave in the gut and the tumor microenvironment, and how they interact with standard drugs. And we are also investigating Australian native fruits and vegetables for gut health as well as metabolic syndrome. But as I said previously, the research on this area is emerging. So there are quite a lot of challenges as well as opportunities. So we are trying to combine genomics and metabolomics together to understand how the gut microbiome impact our health, as well as how herbal medicine and natural products impact the microbiome. But, gut microbiome research has been quite correlational rather than, when it comes to the cause versus correlation aspect of gut microbiome research, it's not very clear because, with studies saying that, if you eat a certain food or if you take a certain medication, it will lead to some communities in the microbiome will go up, some will go down, but that doesn't necessarily might not correlate to a health outcome. So that is why we're investigating the metabolites, which are the end product of the microbiome, and trying to understand the mechanistic, basically, underpinnings of postbiotics in health as well as in cancer therapy. So defining good and bad gut microbiome is also very convoluted. So it is not very clear what is good, what is bad. And we have been trying to do so. And there are about, as I said previously, trillions of microorganisms in our gut. So it's very hard to characterize them. When we talk about gut microbiome research, we're essentially talking about the bacteria, but we are kind of forgetting that there are also viruses, there are also fungi, there are also protozoa. So there are so many other things that also contribute to the microbiome, and we need to look into those things in the future. And our motto is to not use animals for these studies. That's why we are developing non-animal based models such as three-dimensional organoids to study the gut environment. So these are some of our capabilities. So if you can, if you find anything that is useful to you in terms of collaboration from this list, please feel free to reach out to us and we'll be happy to work together. And some of the amazing academic collaborations that I have over the years, including the All India Institute of Ayurveda, and I have the pleasure of working with these beautiful people almost every day. So I'm quite grateful to that. Some of our publications in the space of gut microbiome, food science, as well as cancer therapy. So food for thought would be to use or eat a lot of fiber-rich foods such as fruits and vegetables, millets, legumes, and nuts, and include fermented foods. So India is known for its fermented food, especially South India and Northeast India. I'm from Northeast, and I grew up eating fermented rice. And I think that, and there were a lot of studies on the probiotic activity of fermented rice as well as South Indian foods like idli and dosa. So please incorporate fermented foods in your diet, which will basically give you all three components for gut health. That includes prebiotics, probiotics, and postbiotics. And special thanks to all these amazing people who have enabled me to do this work at NICM Health Research Institute. And I'm deeply grateful. And thank you so much for listening. And I'm happy to take any questions that you might have.
Thank you, Deep, for your beautiful and wonderful presentation. The gut biotic lab is coming up like anything, and congratulations for that. You had a beautiful, informative presentation, enlightening our students, particularly the importance of gut microbiome, as well as the importance of traditional foods and traditional dietary practices. Thank you very much.
Thank you.
Question answer we will keep for the end of the session, if any. If time permits, we'll be taking up. Otherwise, personally, we will be communicating with you. Going ahead with this, the next presentation, next keynote address will be from Dr. Prashant Dharmarajan. Dr. Prashant Dharmarajan is our faculty in All India Institute of Ayurveda here in Delhi. He is associate professor in the department of Panchakarma. Panchakarma is a unique specialty of Ayurveda which deals with the biopurification as well as management of diseases. And he's actively involved in several international collaborations and research initiatives promoting evidence-based Ayurveda on global platform. Presently serving as National Nodal Officer for Ayush Skill Development. It's a center of excellence of Ministry of Ayush, functional in All India Institute of Ayurveda. He's also nodal officer for Department of Integrative Medicine in Safdarjung Hospital. Safdarjung Hospital is one of the largest public sector hospital in Delhi, having more than 10,000 outpatients a day. And he's also instrumental in establishing our extension centers, 5 or 6 extension centers all around Delhi as well as outside. And he's a very, very good, very lucid orator as well as a very good clinician of high demand. And, and now I request my dear colleague Dr. Prashant to speak on one of our research-based presentation, impact of gut microbiome modulation in healthy aging. Dr. Prashant Dharmarajan, please take over. Is our slides visible, sir? Yeah, full screen.
Thank you very much, Rajagopala sir.
Please, full screen.
Slide show.
Please. Yeah.
Thank you very much, Rajagopala sir. Respected Director, All India Institute of Ayurveda, Professor Prajapati sir, Vice Chancellor, Professor Ravi Chandran sir, our special guest from IIT Delhi, Professor Dennis Chang sir from Western Sydney University, Dr. Deep Jyoti Bhuvan, and Dr. Sara. Welcome to this webinar. Thank you for sparing your time. I also would like to acknowledge my colleagues, especially Professor Jonah and Professor Manjusha Madam, who's along with us. So today, I would like to present a humble titled work, which was done on rheumatoid arthritis, which I want to redirect to the specific topic, which is healthy aging through microbiome modulation, and insights from an Ayurveda-based clinical intervention in rheumatoid arthritis. So we know that the healthy aging is a dynamic equilibrium that can be maintained through optimal metabolic efficiency, immune tolerance, and microbial harmony. When this triad is disrupted, most commonly by gut dysbiosis and chronic low-grade inflammation, the body's homeostatic mechanism weakens, accelerating aging. So there is a very good interconnection between these triads. I'm unable to move the slide.
Next slide. Very much. Yes. Okay. Come on. Yeah.
Varun, you may want properly. Is it visible, sir?
No, slow. Yeah.
Okay. So we know that this interdependence between these triads, which is basically related to the metabolic efficiency, immune tolerance, and microbial harmony, is the one which actually decides the aging in a human being. Now, when Ayurveda speaks about health, Ayurveda very specifically speaks about sama dosha, sama agni, sama dhatu, malakriya, prasanna atma indriya manaha, swastha ityabhidyate. So a man who is trying to be healthy should be very much conscious about all these aspects, right from his metabolism to its microbial harmony, including the clarity of his sense organs and the way how he is involving with all the sense organs.
Slides not seen.
वेबएक्स से करना पड़ेगा।
It's not changing.
Can say it now.
So when we specifically speak about rheumatoid arthritis, it's a systemic autoimmune inflammatory disorder primarily affecting the joints, and this condition is characterized by immune dysregulation and chronic inflammation. It's seen that as per the global standard of incidence rate and prevalence rate, RA has substantially increased in elderly population, and RA is becoming one of the major reasons for reducing the quality of life in the aged population who are getting elderly. In Ayurveda, we can correlate this to one of the most commonest condition explained in the later classics of Ayurveda, which is known as Amavata. The Amavata is also very specifically is explained in base of gut dysbiosis, which is later causing inflammation, which is later affecting the entire quality of life of a human being. So what we did in this specific research is to correlate rheumatoid arthritis along with the symptoms of Amavata, which is explained in Ayurveda, and to take the exact treatment principle which is explained in Ayurveda as a model to understand what is the change or the involvement that is happening with the gut microbiome. When we look at the RA progression and impact on elderly, it's seen that there is increased severity along with the age, there is increased burden of disease, increased complication, and whereas also increased immune senescence, which is actually leading to many other complications and different diseases when someone who is elderly is affected with RA and is progressing with a condition like rheumatoid arthritis. So for this purpose, we took an intramural project supported by All India Institute of Ayurveda in the name of effect of Ayurveda treatment algorithm in the management of rheumatoid arthritis and its influence in gut microbiome. As per Ayurveda, it is not a single herb or a group of herbs which is actually helping in managing any kind of condition. It is actually managed by a proper algorithm based principle which is differing from person to person and which is also differing in various stage of the disease. So considering these variables, we took this research project as an intramural project supported by All India Institute of Ayurveda under the leadership of Professor Anant Raman, who is the head of the Department of Panchakarma, and also with the help of Dr. Babutosh Das, who was the microbiome expert from the Translational Health Science and Technology Institute in Delhi. And also it was completely done by the PhD scholar who was the senior research fellow, whose work is what I'm going to explain, Dr. Ashwati. The aim of the research project was to assess the effect of Ayurveda treatment algorithm in the clinical outcomes of rheumatoid arthritis and its influence in gut microbiota. The primary objective of the study was to assess the effect of Ayurveda treatment algorithm and its clinical outcomes in rheumatic arthritis, and to assess the influence of Ayurveda treatment algorithm in gut microbiota of RA patients. The research question was, does Ayurveda treatment algorithm have any effect over the clinical outcomes as well as gut microbiota in RA patients? And we had these hypotheses as null hypothesis and alternate hypothesis. The study was registered under Clinical Trials Registry of India. It was an interventional, prospective, open label, single arm study. The patients were recruited from the Panchakarma, OPD and IPD at All India Institute of Ayurveda. We have received the ethical clearance to conduct this study, and the gut microbial analysis was carried out at Translational Health Science and Technology Institute, Delhi. The outcome measurement was based on the therapeutic efficacy of the evaluated treatment response and patient outcomes, and also on the gut microbiome analysis. The sample size was calculated as per the norms, and we reached a sample with the adjustment of around 50 patients. And the diagnostic criteria was made on the clinical signs and symptoms of rheumatoid arthritis as well as the Amavata. clinical conditions. ACR or EULAR criteria was adopted as diagnostic criteria. Patients aged 20 to 60 was chosen for this specific study because we wanted to conduct all the therapeutic procedures which were required to be carried out in the Amavata treatment. So we fixed this age group. We had clinical features of classical Amavata, fulfillment of American College of Rheumatology presentation, RA chronicity who had less than 5 years, and who are having eligibility of all the Panchakarma procedures. Patients having severe crippling deformities, patients suffering from paralysis, diagnosed cases of neoplasm of spine, arthritis of other conditions, patients diagnosed with associated cardiac diseases, and other systemic illnesses, and recent use of antibiotic therapies and immunosuppressants less than 3 months, and pregnant women and lactating women were excluded from the study. We had an approximate treatment duration of about 84 days of intervention right from the day one. The design intervention basically was starting with the classical lakshanas of Amavata and rheumatoid arthritis, which is fulfilling ACR criteria. From there, this algorithm was formed who meets the inclusion criteria, was again diagnosed on base of the condition of the disease as per Ayurveda classics, Samavastha and Niramavastha. Again, we divided them into various levels of these avasthas, and based on that, as per the algorithm that's explained in Ayurveda, we have tried to put forward our intervention on base of Ayurveda to understand what is the clinical results in this, as well as what is the change in the gut modulation. These were the assessment measures or outcomes that we were trying to assess. Subjective parameters included the Amavata clinical symptoms along with clinical disease activity index. We also had patient activity scale. Activity of disease was assessed with disease activity scale, and ACR and EULAR criteria was used both for diagnostic and assessment parameters. Gut microbiome analysis was carried out, and inflammatory tests, inflammatory marker tests including C-reactive proteins, erythrocyte sedimentation rates, rheumatoid factor, ACPA, all these were assessed and statistically evaluated. This is an overview of the basic algorithm that we followed. We had 25 to 30 varieties of various stages of diseases where we had this intervention being carried out. We had 10 sets of treatments which were interventional and 16 internal medications as a black box design as per the stage that we call as the stage of the disease and the stage of the diseased. We very specifically induced these based on the criteria, and we try to assess the outcomes after the treatment and follow-up, and also we try to assess the microbiome. So in total, we had around 113 patients who were screened, out of which 67 patients were having screening failure. We enrolled around 50 patients, among which 4 dropped out, and 46 of them completed the protocol of assessment. So these were the various algorithmic flow of various stages at which various treatment was adapted to all these patients. Coming to the observation and results of the entire thing, this is how the entire flow went on from the enrolled patients, and these are the demographic profiles that we observed. Among the patients, we could find that right from age of 41 to 50, the incidence of Amavata or rheumatoid arthritis was highest, followed with 51 to 60, which is also substantiating the age-related prevalence of rheumatoid arthritis, which is affecting the quality of life of the patients. Gender-wise also, it was showing commonness with the global standards where females were affected more, who are having sedentary lifestyle habits or more of standing work, life balance, where they were having more standing. So joints were more inflamed and more disturbed in a later stage of life, and this was the beginning because we only did the study till 60 years of age to conduct all these therapies. These are the basic results that we could understand. Based on the results on various symptoms which included both Amavata and rheumatoid arthritis, including swelling, temperature, redness, a range of movements, and all the Ayurveda symptoms of Amavata, including Angamarda, Aruchi, Trishna, which we call as various symptoms, we found that there is statistically significant difference at a p-value less than 0.01 in all these symptoms after the treatment and after follow-up when being compared. So these results are really promising when it comes with the clinical outcomes, which is very specifically carried out as per Ayurveda principles. When we looked up at the patient activity score, disease activity scale, and the inflammatory marker like erythrocyte sedimentation rate, even in that we could find that there was very significant results which was showing statistical difference also. The overall improvement was observed in ACR criteria. We could find changes in VAS scores. We could find changes in clinical disease activity index. We could find statistically significant results in swollen joint counts, total joint count, provider global index, and patient global index, along with RA factor and anti-CCP. So these statistically significant results were very promising as we tried to adopt the entire principle of Ayurveda, right from the patient aspect to the disease condition aspect. So now coming to the microbiome analysis, which we are supposed to discuss, we collected 186 fecal samples, which was analyzed. 46 healthy controls were used for the study to analyze between the diseased and the control. Most of them were the family control. We used the spouse controls who had no RA or Amavata symptoms. 46 RA patients who completed the protocol were analyzed in 3 time points: before treatment, after treatment, and during follow-up. We also assessed a subset of 2 asymptomatic patients in long follow-up after 6 months also. Approximately 3 grams of stool was transferred into sterile container, which was stored later in -80 degrees Celsius and later transported to Translational Health Science Technology Institute, which is in Delhi, which is around 15 kilometers from our site. And there we try to use and understand the metagenomic extracted DNA, where enzymes for cell wall of RNA removal, the purity and content of DNA were evaluated using a biospectrometer and electrophoresis methods. So we extract the DNA and we tried the sequencing. And bioinformatics was done using these pipelines. And taxonomic assignment was achieved using Silva database for accurate classification. And this was the methodology that we used for understanding the microbiome sequencing. So what we understood from the study is that there is a diversity between the healthy and patient microbiome when specifically analyzed with the CHAO-1 index significantly at a p-value less than 0.05 in healthy subjects as compared to the patient population. So you can see the healthy subject and the patient, the microbiome diversity or the species richness is high in patient, which is a good information to collect. Whereas when it comes with Shannon diversity, where number of species and the evenness was tried to be analyzed, we could find that non-significant results came between the groups, that is between the healthy and patient group. But whereas the species richness showed significant results at a p-value less than 0.05. When it came to alpha diversity in the intervention that we tried to see, we found that there is microbial loss in rheumatoid arthritis patient, which is real, especially of rare taxa. We can see that there is a less number of species loss in the RA patients. The microbial richness was lost during the progression of rheumatoid arthritis condition, which could be restored during the treatment process. So this was the basic outcome that we could find out during the analysis of 3 sets of patients which were healthy, which was patient, and after the intervention. So all these comparisons shows very good changes in microbial richness and involvement of rare taxa in RA. When we try to understand the beta diversity indices, the microbiome composition between healthy and patients significantly altered at a significant level. The overlapping of clusters suggests that dysbiosis in RA is not a complete loss of commensal microbes, but rather a shift in the relative abundance and community balance. So there was some kind of balance which was achieved after the intervention, which we could systematically see in the analysis of diversity at a different rate, and the dysbiosis was very much evident in RA cases too. So now when we try to check the compositional variation between the healthy and patient population, we could find a relative abundance difference between healthy and the RA patients, especially in specific dominated bacteria. In healthy, we could find that it was dominated by bifidobacterium, lactobacillus, and short-chain fatty acid producing bacteria, which were indicating a balanced anti-inflammatory environment. But when it came to RA patients, we could find the enrichment of Prevotella species, Collinacella species, Sotorella, and Parabacteroides, which suggest a shift towards pro-inflammatory dysbiosis, which was very specific in RA cases. And this also suggests the loss of gut barrier protection and increased immune activation. So this, when analyzed with our microbiome analysis right from the healthy control, before treatment, and after follow-up, we could find that there was a notable enrichment of beneficial bacterial genera such as Faecalibacterium, Agathobacter, Bacteroides, while potentially pathogenic or pro-inflammatory genera, including Prevotella and Streptococcus, showed relative decline after the follow-up, although statistically significant results in the microbiome composition were not observed. So we could find a very drastic change right from the time of before treatment till the follow-up period. And even when you look at the subsets, we can see that the patients who didn't have remissions would have complete maintenance of that and that enrichment of the species of good bacteria, what we call, which were non-pathogenic and which was against inflammations, were very much enriched. So this is a very good sign to understand that the Ayurveda interventions, which we followed according to the principles of Ayurveda, is very specifically acting at the level of gut microbiome to enrich and provide a better harmony inside the system to have a non-inflammatory pathology, which indirectly showed its effects even in the clinical symptoms with statistical significant results. So it was a double kind of understanding. So the beneficial bacterial genera, including Faecalibacterium, Agathobacteria, Bacter, and Bacteroides, because Faecalibacterium can produce butyrides, which can support the gut barrier integrity, which can reduce inflammation. Agathobacter can generate SCFA, that is short-chain fatty acids, which is crucial for nourishing colonic cells and maintaining gut stability. And Bacteroides that fits in regulating metabolism and balancing immune responses, crucial for gut health. So these three were really enriched, and these three were really helpful in reducing the symptoms. When the negative impacts of the pathogenic bacteria were understood, when you look at Prevotella, it triggers immune responses, increasing inflammation in the body, whereas the Akkermansia degrades mucin, compromising gut barrier integrity, and this regulation is caused by Escherichia, Shigella, which contributes to immune system imbalance. So we could find the reduction of these specific genera of bacteria, as well as we could find the increase and enrichment of the good bacteria, which was said previously. So to conclude, the understanding the impact of the individualized Ayurveda management in rheumatoid arthritis, especially when we look at this aging population, we could find the intervention significantly enhances the clinical efficacy in managing rheumatoid arthritis. All these factors, including RA factor, ESR, CRP, ACPA, had shown significant results. Even the quality of life symptoms like clinical disease severity activity, patient activity scale, and disease activity index and disease activity score all showed significant reduction after the treatment in the patients who underwent the treatment clinically. When it came to microbiome modulation, with regard to the secondary objective, there was notable enrichment of beneficial bacteria genera such as Faecalibacterium, Agathobacter, and Bacteroides, while potentially pathogenic or pro-inflammatory genera, including Prevotella and Streptococcus, showed relative decline after the follow-up. These microbial shifts provide a valuable indication that Ayurveda treatment may exert a modulatory influence of gut microbial ecology in RA patients based on the clinical outcomes too. So these were the enrichment and these were the reductions that we could conclude with this study. And even in the follow-up after a month, we could find that the long follow-up also showed sustained results of these enrichment of bacteria which was present inside the patient. So the long-term follow-up was done on a subset who never showed any remission symptoms, and we could find these bacteria were really stronger, and inflammatory taxa like Prevotella were indicating lesser presence. So durable restoration of gut microbial homeostasis was aligned with the clinical remission, and this pattern indicates the restoration of mucosal stability and suppression of inflammation, confirming that the remission consolidates healthy short-chain fatty acid dominance. So after 6 months, we could understand that the enriched genus remains same in comparison to the before treatment. You can see the difference on the subset which we analyzed. The enrichment remains same even after 6 months of long follow-up, which is very positive, which is very promising for Ayurveda intervention, that it is not a temporary magic which happens just after the treatment protocols, but it is also something which can be observed in long-term follow-ups like 6 months too. So the hypothesis demonstrated that the Ayurveda intervention significantly influences both therapeutic outcomes and microbiome modulation in RA, and the results indicate that the measurable improvement in clinical symptoms and microbiome balance, effectively rejecting the null hypothesis and reinforcing the value of integrative approaches in chronic inflammatory management. The individualized stage-specific Ayurveda approach is effective for control of RA and shows microbiome modulatory potential, supports host microbiome integrative mechanism in chronic inflammatory diseases. This is a small chart wherein we tried to correlate the pathogenic activity, what would have happened with the changes along with the microbiome, and the understanding of Ayurveda, how this pathogenesis can get back, the Ayurvedic principles through which how a condition like Amavata, which we understand as rheumatoid arthritis, can be changed, and how these microbial changes is happening. So we have certain strengths and we have some limitations, and I find some opportunities too in this. The strengths were the statistically significant clinical reductions in the scorings and the Ayurveda treatment based on the patient and the stages of the disease, the beneficial bacteria, the healthier enrichment, and the microbial changes in the entire flora that happened. And we had these constraints, including the strengthening of protocol, because we had limitations with around 17 medicines. We needed more of medicine which could have been included. When we were conducting, we understood that we can have more elaborate and wider black box designs, including entire principle of Ayurveda, study design, follow-up, patient numbers we can increase and do, and we can also conduct mechanistic understanding studies, which can go into deeper insights of microbiome. And opportunities is to understand longitudinal population-based studies in different age groups to track microbial variation across lifespan who are under the Ayurveda care, and multi-omic integration, as Sir has already quoted, evaluation of short-chain fatty acid profile, especially butyric signature, as measurable biomarker correlated with healthy aging under Panchakarma-based interventions. Focused mechanist research on beneficial genera such as Faecalibacterium, Agathobacter, bacteroids to identify microbial hubs that support healthier aging transition. Controlled clinical trials in pre-elderly adult population, testing preventive benefits for more functional decline. To sum up, collectively these findings highlight interconnection between gut microbiome modulation, immune regulation, and systemic regeneration, the key processes underpinning healthy aging. By mitigating inflammation, rebalancing microbiota, and enhancing physiological resilience, Ayurveda's personalized treatment algorithm represents a holistic evidence-based framework in promoting quality of life in healthy aging. Rheumatoid arthritis, viewed as an accelerating aging condition driven by immune metabolic dysfunction, serves as a translational model to understand how targeted gut microbiome modulation can contribute to signs of healthy aging. My sincere acknowledgements to Professor Vaidya P.K. Prajapati sir, who is the director, and Professor Mahesh Vyas, who is the Dean of PhD Studies, Professor Yogesh Badwe, who is the Dean of PG Studies, Professor Manjushra Madam, who is Dean of Delhi University, Professor Jonas sir, who is Dean of International Coordination, and my dear Professor Raju Gopala sir, who is the Dean of International Coordination Cell of Ayurveda. The entire study was the brainchild of Dr. Anantaraman, who is the professor and head of the Department of Panchakarma, and it was held and conducted by Dr. Babdosh Das, who was from THSTI, and it was completely conducted and very meticulously documented by my PhD scholar, Dr. Ashwati, and the scholars of the Department of Panchakarma who had helped in conducting this work very well. And I also thank the entire team of International Coordination Cell of Ayurveda, including Dr. Manish and Dr. Varun, for giving me this opportunity to conduct the study. Thank you very much. Sincere acknowledgement. Thank you.
Thank you very much, Dr. Prashant, for an elaborative presentation of complete work comprising of two components. One is rheumatoid arthritis and management. Second part is the effect of management, whatever package you have given on the gut microbiota. And you have also highlighted the strengths and limitations of the study. Thank you very much. Now going ahead with the same gut microbiota related, we have Dr. Sara Aladdin, who is a research scholar in Western Sydney University in National Institute of Complementary Medicine, investigating gut microbiota with gut-brain interactions. Her research focuses on effect of fecal microbiota transplantation on cognitive functions in humans, with a background in clinical neuropsychology, specializing in disorders of consciousness and neurodegenerative diseases. She is particularly interested in patient well-being and quality of life. Yes, use of human urine, self-urine therapy is well recorded in Indian literature, but use of fecal transplantation is comparatively a new topic to us. Dr. Sara, a warm welcome to you, and please present your deliberation. Welcome, please.
Thank you. I was wondering if you can see my screen.
Yes, madam. Yes,
yes?
we can.
Okay, perfect. Yeah. Thank you so much for the very, very kind introduction, and thank you for having me today. I really appreciate it. I would like to clarify that I'm a PhD candidate. I've submitted my thesis, but my PhD is not conferred yet. That's why I'm not officially a doctor yet. Thank you. So I would like to start by acknowledging the traditional owners of the land on which I live and work, the Gadigal and the Darawal people, and pay my respect to the elders past and present. Thank you. So as we heard in the introduction, I'm looking at fecal microbiota transplantation. And my research question was if fecal microbiota transplantation or a stool transplant can enhance cognitive function in humans. So we heard quite a bit about the gut microbiome already today. And as Dr. Deep said, the microbiome is quite dynamic, but it is also quite steady too, I would say. So I would just like to give a little recap. So the gut microbiome is the entity of all microorganisms in the gut. And I know that in research, we talk a lot about bacteria, but I just want to highlight that there are different microorganisms, such as fungi and viruses, who also play a role in the gut microbiome. And as we've heard before, the gut microbial composition is highly individual and it's influenced by many, many factors. For example, diet, as was highlighted before, or medication, or even the way you were born. But I just wanted to highlight that within a person, we still see something like a very, it's not completely stable, but it's quite stable in an individual after people reach adolescence. And so while the microbiome looks quite different in everyone, it is quite stable in a person despite minor changes. Next, I would like to talk about the term microbiome dysbiosis. So as I just said, the microbiome looks quite different in everyone. However, there are some conditions where we see something that's called a microbiome dysbiosis. And I think this was highlighted in RA before. But we also see such a microbiome dysbiosis, which is characterized by a reduced diversity and a loss of beneficial microbes and an increase of pathogenic microbes in neurological conditions, such as dementia and mild cognitive impairment, or MCI. Now, I think we're probably all familiar with dementia. I just want to give a quick overview of what mild cognitive impairment, or MCI, is. That's a prodromal stage of dementia. It is characterized by an objectively measurable cognitive decline in one or more cognitive domains. But what we do see is that people are still able to live independently.
Sarah, sorry to interrupt. Your slides are not moving.
Oh, they're not moving?
Yeah.
Okay. Let me just check if there's I'll stop sharing and share again. Sorry about that.
That's okay.
Thanks for letting me know. Okay.
Yeah, that's good. Yeah.
Yeah.
You can maximize the window if you like. Yeah.
Okay, can you see my slides now?
Yeah.
Yeah, great. Okay, great. Okay, thank you so much. Okay, so I was just
sorry,
talking.
Sarah.
Yeah.
Sorry, Sarah. You're not on presenter view, by the way. We can still see.
I am not. Okay.
Yeah, maximize the window. Yeah.
Let me check. How do I do that?
It's on the right lower corner.
Yeah,
that one. Yeah.
Yeah. But yeah, it's not working, I think.
It's not working. I might have to go back into my slide view. Then I don't have any notes anyways. I hope that's okay.
Okay.
Yeah, that's
fine.
Yeah, perfect. Okay. Can you see my screen now? Yep. Okay. Just double checking. Great. Okay. Yep. So I was just talking about MCI as opposed to dementia. So in dementia, people don't have the ability to live independently. In an MCI, although we do see a cognitive impairment, the condition is not as far progressed. So they can still keep care of themselves. So as we know, that's a shame. No, my animations are not working, but we'll have to live through this. So dementia is a brain disorder. So we know that neurodegeneration is a loss of neuronal function and structure, and the most common form is Alzheimer's disease, which is characterized by an aggregation of misfolded proteins in neurons in the brain. However, we also see a gut microbiome dysbiosis in these conditions. And we not only see that in the far progressed stages of dementia, but also in the prodromal stages, such as MCI. Now, you might wonder how the gut microbiome actually interacts with the brain. And this happens via a multi-pathway system called the microbiota gut-brain axis. So we've got neuroanatomical routes. I'll just point them out here. We've got the vagus nerve, which directly connects the brain and the gut. Then we've got bacteria metabolites. Short-chain fatty acids were mentioned before. These bacteria metabolites can enter the bloodstream and then reach the brain, and some of them are even able to pass the blood-brain barrier. And then we've got the immune system. So we know that the gut microbiome interacts with human immune cells directly or via metabolites, and this interaction can also influence the brain and the nervous system. Now, there are several ways to modulate the microbiome. We spoke about pre, pro, and postbiotics earlier today. There's also antibiotics which induce a significant change in the gut microbiome, although that's not always beneficial. And then we've got fecal microbiota transplantation. And this is what my research was focusing on. So fecal microbiota transplantation, or FMT, has been around for quite a while. So it has been described in ancient Chinese medicine already, and it was used to cure severe diarrhea. And this is actually what it's clinically used for in hospitals worldwide to this day, because we currently use it for severe recurrent C. diff infections, which is a bacteria infection that leads to severe diarrhea. And it's quite effective, so it leads to a 98% cure rate, which is very impressive. There is also emerging evidence that this might be helpful in other gastrointestinal and neurological conditions too. It's generally safe and well tolerated, and we know that microbiome changes last for 1 year or longer. You can administer it orally or rectally, and in my studies, I went the rectal route. So the key questions guiding my research were, can FMT enhance cognitive function in pre-dementia stages, such as MCI? And does FMT influence cognitive function in neurologically healthy adults if they are treated with FMT for another condition, such as Crohn's, for example? So is it cognitively safe? So first of all, we try to look at what's out there already, and we published a review earlier this year, looking at all the clinical trials, looking at the impact of FMT and cognitive function. You can't see the underlying slide, unfortunately, but the takeaway message is that FMT improved cognition in quite a few conditions, and I would like to focus on the dementia and MCI studies. So there were 2 case studies, 1 cohort study, and 2 single-arm studies with an N of 5, so not much out there, but all of these studies combined, they reported positive outcomes for cognition after FMT. So this is what I based my research on. So what I did was I conducted 2 double-blind randomized placebo-controlled pilot studies looking at participants with irritable bowel syndrome with or without mild cognitive impairment. So one cohort was cognitively healthy, the other had cognitive impairment. And I tested their cognition, mood, and biomarkers, so blood and stool samples at baseline. Then they were randomized to receive a single dose of FMT or placebo, and then repeated the same test we did at baseline over the course of 6 months or 12 months in the cognitively healthy cohort to see if there would be any change. So what I was hoping for was, especially in the MCI cohort, I was hoping to see a cognitive improvement in the FMT group only and no cognitive improvement in the placebo group. So let's look into the results. So my group level analysis. So looking at the cognitive function was quite disappointing. So I tested 17 different cognitive outcomes, and on the group level, I did not see any significant treatment effect on any of the cognitive outcomes in either study. So as you can see here, some cognitive scores improved over time, but this is quite consistent with the practice effect because we did see it in the placebo group too. So I think it's just if you repeat a task many times, you just get better at it. Next, I was interested in depression, anxiety, and stress scores. And yeah, as you can see, we didn't see any effect of FMT on any of these scores in either cohort. Regarding plasma and gut microbiome analytes, I looked at short-chain fatty acids, tryptophan and kynurenine levels in plasma, and I also looked at 46 different cytokines and quite a few gut microbiome markers. And on the group level, I also did see no significant difference between the FMT and the placebo group. So this was quite disappointing. However, I decided to have a closer look at the individual level. And what I did see was that there were 2 out of a total of 12 FMT recipients who showed a major microbiome shift, so an increase in alpha diversity, and I've highlighted these 2 here. And they also showed a significant shift in the microbiome composition, which is something we didn't observe in any other participant. So that made them quite interesting to me. So I decided to have a closer look at these 2. And what I did see that was one of them also showed cognitive improvement, which actually moved her out of the MCAI range after 6 months. So after 6 months, she scored perfectly normal on cognitive tests. However, this could be a coincidence too. So I can't guarantee that this is treatment related because it's just an N of 1, but it was nonetheless interesting. So I decided to look into her microbial patterns and the changes we did see in the composition. And I did see that she was the only participant where we saw a significant shift of the firmicutes to bacteroiodota ratio. So more firmicutes, less bacteroiodota. And the interesting thing is that such a pattern has been linked to cognitive improvement in the literature before. So I think this might be something to look into later. What I did ask myself was, why did only 2 respond to FMT out of all my FMT recipients? So I would like to just go into factors associated with FMT success really quickly. So we've got donor factors and recipient factors, and then also factors such as timing, dose, and administration related to FMT. So my first question was there anything that was special about these 2 recipients that just helped them to retain the donor microbiome? And so I looked at their baseline biological profile, and this is just an example output. But as you can see, these 2 responders were quite similar to everyone else on the study, and it was the same for all other baseline biological markers. So really nothing set them apart from everyone else or could explain why they were the ones responding. So next I looked at donor factors. So for the both studies, we had different donors. This one donated to all people on the MCI study, and this one to all people who were cognitively healthy. And as you can see, their microbiome profile looks quite different. However, when you look into the predominant species, these are all beneficial species. Some of them are short-chain fatty acids producers. So just based on this microbiome profile, they look perfectly healthy. Both were young medical students in their early 20s. Another thing that we could take into account for FMT success is donor recipient factors. So it looks like a similar donor recipient age can help with better FMT outcomes. This was definitely not the case in my studies because, as I said, my donors were early 20s. Most of my recipients were in their 60s and 70s. And nowadays, there are machine learning tools available that predict optimal matches between recipients and donors based on many biological factors. Unfortunately, these tools were not available when I started my PhD. So yeah, I haven't done any donor recipient matching. Another thing that might have influenced the FMT success rate is the administration technique. So what I did was single dose rectal retention enema just because it's quite simple and it's less invasive. You don't need to sedate people. It's a quite simple procedure. However, there are many, many other techniques, and it looks like a colonoscopy, although more invasive, might be more promising. So this is something future studies could keep in mind. I found one interesting result apart from FMT, namely that independent of treatment group, a higher microbial diversity was linked to better cognitive function in both studies, and that was independent of age. So no matter how old my participants was, my youngest was 90, my oldest was 82. No matter how old they were, the higher the microbial diversity, the better their cognitive performance. So my take-home message is basically FMT is not universally effective, unfortunately. So outcomes likely depend on recipient and donor factors. But gut microbial diversity is positively linked to cognition. So I think future studies or future interventions should probably focus on boosting alpha diversity to hopefully then influence cognitive function in a positive way. And FMT still remains promising, but it may require improved donor recipient matching. So for example, machine learning or just a different, more invasive administration technique. And I would like to thank my team at Western Sydney University and at NICM for all your support throughout my 3 years of my PhD. Thank you.
Thank you, Sarah Ladin, for a lucid and informative presentation. Yeah, we are aware of use of different human products also, animal products also, and your presentation was again giving some impetus for our research activities. In Ayurveda literature, at one disease condition where emaciation, losing of bulk in the body, muscle bulk as well as body strength is considered, their use of animal, particularly cow dung based preparation is mentioned internally as well as in the form of enemas, rectal route. But this human fecal transplantation is comparatively a new topic to us, a new input for our future research activities. Thank you very much for your presentation.
Thank you for sharing. That was really interesting.
Yeah, thank you. Going ahead with, of course, we are running short of time now, and I invite Dr. Pramod Yadav. Pramod Kumar Yadav is an associate professor in the Department of Rasashastra and Bhaishajya Kalpana, that is pharmacy and pharmaceutics in Ayurveda, and he holds a MD postgraduate degree and PhD in the subject, has an expertise in Ayurveda pharmaceutics, quality control and drug standardization. He has more than 30 research papers published. Also, he has authored 2 books. He actively guides postgraduate as well as doctoral research programs of All Indian Institute of Ayurveda, and he is a recipient of quite a good number of awards such as Ayurveda, Shodha, Vibhuti, etc. And he is going to present one of the research activities conducted under his guidance, evidence-based approach towards the management of dementia from bench side to bedside. It is from the lab to practice. Dr. Pramod Yadav, please take over. Its screen is visible.
Sir, the screen is visible, but the slides are not visible.
Yeah, slides are moving now.
No, sir, I cannot see the. It's just showing the window where all the presentations are placed.
Okay. Once again, we are resharing. How about it now?
Sir, it is visible.
Okay. Fine.
Yeah.
Take over.
So, thank you, Dr. Rajgopal sir, for providing me this opportunity. So, I would just like to share some of the experiences in how to make the aging a healthy one and a lively one. And Dr. Sara has already set the tone where she has worked extensively by using the fecal gut microbiota on the conditions of MCI. So maybe my presentation would be outlier, but I just want to share the learned audience about how we can convert an Ayurvedic formulation from bench side to bedside to community by using the conventional tools for translation. So why did I choose this topic? Next, please. Can I have the next slide, please? Yeah. So why did I choose dementia? Because as we all know that since the improvement in the healthcare system and the facilities across the globe has led to the increase in the lifespan, and as the lifespan increases, so also the dementia, which is related to or which is considered to be a disorder of aging, also increases. So that's why this topic has been chosen, was selected by our research team. Moreover, since we are working in a very isolated lifestyle, people are working in silos. They have very little, you can say, contact with the external world, with their family, with their friends. They are constantly on the mobile phones or the gadgets. So that also is one of the major cause to induce dementia when they grow older. Because studies have shown that nearly there are more than 30% chances of people who are working in isolated conditions to have dementia in their late stages of their life. Also, so this century we are witnessing a lot of metabolic disorders and health, and a few studies have highlighted that poor metabolic health can contribute about 12% of chances of having dementia in their early ages, and more than 24% chances of dementia in their late 60s. So that's why it is a major area of research and concern to us. Next, please. Can we have the next slide? So the Ayurveda understands this process of cognition where it is considered to be a chariot, and the knowledge acquisition is through this process, through this channel of the sensory organs, through the man and through the buddhi and the consciousness. So the 5 horses, they represent the 5 sense organs, and the person who is riding, who is in control of this chariot, is the intellectual, higher intellect, that is the buddhi, and he tries to control it with his mind. So if there is mindfulness in our thoughts, in our actions, so the chariot will go to a proper path, will lead to a proper path, and the Atman, that is the higher consciousness, is just an observer in this process. Next, please. Can we have next slide? Yeah. So we selected Alzheimer's disease because in Alzheimer's, there is an impairment of memory, and also the language skills, the articulation gets hampered, as well as the reasoning power, also the locomotor skills, the mood swings are observed. So that's why we selected the Alzheimer's disease for looking into the efficacy of an Ayurvedic formulation, how it can alter the changes of dementia as seen in the Alzheimer's disease. Next, please.
So the Saraswata Grit is a formulation which is a lipid-based formulation. It is mentioned in the Ayurvedic classics of Ashtang Hriday, and it is known to promote the intellect. It is known for promoting the speech and also the Agni, as well as the which we consider as an appetizer. And it is composed of 8 ingredients, and it is processed in the cow's ghee, that is the clarified butter, and it also has the goat's milk as one of its ingredient. And through a specific process which is mentioned in the Ayurvedic classics, this medicated lipid-based formulation is prepared, and it was administered through oral route and through the nasal route in the patients. Next, please. So the methodology that we followed to understand that how this formulation can improve the cognitive functions or the dementia in cases of Alzheimer's. So we first carried out an chromatographic analysis, which was followed by an in silico study. We also looked into the herb-drug interaction part, and then the formulation was subjected to in vivo study on the experimental rats. Then we got few encouraging results and subjected this formulation for clinical study. It was followed by the proteomic study, and then we translated this formulation as a public health measure and initiative. Next, please. So next, the chromatography analysis, we carried out the gas chromatography mass spectroscopy analysis for the samples. That is, we subjected the methanolic extract and the hexane and ethanolic extract of this formulation, and we found about near about 197 phytoconstituents were detected in the GC analysis. Further, this formulation was subjected to LC, liquid chromatography. Next, please. Analysis, where also we found out a large number of phytoconstituents. We ran it into positive and negative modes both, and nearly 215 phytoconstituents were detected. So moving ahead to the in silico study. So in the in silico study, this formulation, the phytoconstituents were mapped with the targets for the Alzheimer's disease, and we found more than 600 overlapping targets. And on further robust analysis and further dynamic studies, we found that two particular compounds, that is LIG 212 and LIG 91, they exhibited strong binding affinities and favorable interactions with the acetylcholinesterase, along with predicted blood-brain barrier permeability, highlighting their potential as a therapeutic candidate for Alzheimer's disease. So this gave us some insights into that this formulation can be useful. But as we talk about considering the old age, generally we deal with the problems of polypharmacy, where the patient already is under a lot of medications. So in such conditions, if he's taking any sort of herbal supplements or Ayurvedic medicines, there are highly chances of herb-drug interactions. So we also assessed our drug whether it has any sort of interaction with the known pharmacopoeial agent which is given in the geriatric condition, that is donabzil. So there also we find encouraging results. So so we took the cytochrome P enzyme as a model for conducting the herb-drug interaction study. So the donabzil, which is a standard line of treatment in the cases of Alzheimer's, it exhibited a binding energy of minus 10.8 across all 3 enzyme targets, which reflects a strong inhibitory potential. In contrast, the other compounds emerged as the top candidate, that is MON111, and through network pharmacology analysis, it demonstrated the weakest binding affinities with each enzyme, indicating that high network centrality does not necessarily predict strong molecular recognition in silico. So the interaction was ruled out through this study. So we took this formulation and we carried out experimental studies on the rats, where we induced Alzheimer's. In the rats, we induced the Alzheimer's dementia specifically through aluminum chloride and D-galactose injections were given to these rats. And we ingested the animals with the Saraswata Grit, that is the lipid-based formulation, at different doses, at low dose, medium dose, and high dose. And also one group we had kept that this formulation along with donabzil. We assessed the outcomes on the Morris Maze water test for learning memory. We also carried out the reversal learning and executive function test. Further locomotor activity was assessed. We did certain brain inflammatory markers like IL-6, TNF, and myeloperoxidase, also the acetylcholinesterase activity was assessed along with the histopathological parameters for brain. So this was a study which was carried out with the help of our MOU partner, that is MIT University. Previous slide, please. So in that study, we found out that there was a dose-dependent neuroprotection of the Ayurvedic formulation, and also few of the efficacy was comparable or also found to be exceeding to that of donabzil in some of the parameters. Next, please. So this gave way for a small pilot scale study where we did on the patients, and the study was carried out in collaboration with IIT Delhi, where two groups of patients were selected. The first group were treated with the standard line of treatment, that is donabzil, which is ACE inhibitor, and the second group was treated with Ayurvedic drug along with the modern allopathic drug. And the IIT Delhi had developed an EEG-based tool to assess the subcortical signals which comes out of the patient. The patients were also assessed on different scales, that is MMSC and MoCA scales. Also, we did certain biochemical parameters. P-tau 181 was, which is a standard marker in cases of Alzheimer's dementia. So that was also assessed. And the study demonstrated that EEG-based matrices, that is the F E:1 E:I ratio, that is the functional inhibitory is to the excitation ratio, particularly effectively captures the treatment-related changes in Alzheimer's disease. So we were able to differentiate between the healthy volunteers, between the mild cognitive impairment, and between the patients who have developed full-fledged dementia, as in cases of Alzheimer's. And there also the drug proved to be significant improvements were observed in the cognitive outcomes, neurochemical markers, and also it was reflected through EEG. Next, please. Then we conducted a large-scale study. Next, please. So this large-scale study was conducted in the next slide, please. Yeah, so the large-scale study is a part of PhD work which was carried out by Dr. Robin under my guidance. And in this study, the primary objective was to look into the efficacy of the nasal administration of Saraswata Grit in the patients of Alzheimer's disease. So we screened 370 patients, and 124 patients were included into this trial. And this trial was registered with the CTRI and also had the ethics approval. And the assessment was done on various subjective parameters and various objective parameters. We took MMSE scale, MoCA scale, ADAS COG scale, as well as the quality of life was assessed for these patients. And also on the biochemical parameters, we carried out serotonin levels, we carried out tau 181 levels, and other biochemical markers. Next, please. So from this study also, we found it can be seen that there are changes in the MMSE and MoCA scales in both the groups. The group A was treated with standalone allopathic treatment, and group B was administered with Ayurvedic and allopathic both treatment. The Ayurvedic medication was given through the nasal route. So overall, the group B demonstrated a greater improvement across most cognitive biochemical parameters as well as quality of life. So it suggests that Ayurveda has a promising role in management of the neurocognitive disorders. Next, please. So further, what we did that we took the samples, we took the blood samples, we separated the serum, we separated the plasma from it, and that was subjected to the proteomic study. This study was carried out with the help of IIT Delhi, and we did the Western blot analysis and gel electrophoresis, where, next please, we found out that in comparison to the healthy control group, the group which received donabzil and also the group which received the Ayurvedic medication as well as the donabzil, so there were differences in the manifestation of tau 181 levels, and this suggests that the adjunct Ayurvedic treatment along with the allopathic medication can have a better efficacy in lowering the tau 181 protein levels. So further, we went for one step ahead, and comprehensive protein expression mapping was done. The samples were subjected to the LCMS analysis. We did the Orbitrap analysis, LCMS-MS, for these protein samples. So the proteins were identified and their quantification was done. And then the listing of the proteins was undertaken, and thereafter we applied certain advanced statistical method, and also the gene ontology and functional enrichment was done. So next, please. So the heat map and the volcano plots that you can see. So there are distinctive differences between the proteomic profile of the healthy patients and those suffering with the dementia that is induced due to the Alzheimer's. Next, please. Further, it can be also seen distinctively that the combined therapy of Ayurveda and allopathy, it demonstrated a broader proteomic response because we have seen a higher variance in the principal component analysis, separating them from the healthy cluster. Also, a higher number of significantly modulated proteins involved in neuroprotection and anti-inflammatory pathways. So the heat map and the volcano plot patterns support that the Ayurveda and allopathic regimen can induce more pronounced normalization of dysregulated proteins than Ayurveda alone. So we got very encouraging results on the clinical trial, and then we converted this formulation. We took one step ahead, and we looked into it that how we can benefit the community with this with the help of this Ayurvedic intervention. Next, please. So we carried out large-scale community-based intervention. So this was the project which was funded by Ministry of Ayush, and in this project we again administered this Ayurvedic intervention, that is Saraswata Grit, along with other formulations. And we looked into supporting the physical and mental health of the elderly population of a particular district of state in India. So here again, the analysis and outcome assessment was done on the MMSE scale. We took the 6 CIT scale along with the WHO quality of life assessment and other biochemical parameters like serotonin, DHEA, and dopamine and acetylcholine. Next, please. So in this project, we screened a total nearly about 6,000 patients and enrolled 5,500 patients. So we found out a mild cognitive impairment in 748 patients. So these patients were then again like excluded on the basis of comorbidity, and we selected 178 patients in which the Ayurveda intervention of Saraswata Grit, that is the lipid-based formulation, was given. And we found out that on the basis of the statistical analysis, that is repeated measured ANOVA test, there was difference at the baseline and after 120 days of intervention. The intervention was given for 120 days. So the scores, you can see that the baseline reading is 11.85, which decreased to 2.77 in case of the 6 cognitive impairment testing scoring. And further on MMSE scale also, the improvement was seen and the result was statistically significant. So next, please. So we also came out with some beautiful publications in the BMC. We also published in the Journal of Alzheimer's Report and also in the data science as well. Next, please. So we can conclude from these findings that the Ayurvedic formulations, they can be tested on the contemporary parameters as well. And the in vitro and the in vivo studies have demonstrated that they have the ability to enhance the spatial memory and reduce the oxidative stress and amyloid beta plaque, which is the hallmark of Alzheimer's disease, which ultimately leads to dementia. And it suggests a neuroprotective role of this formulation. So we have demonstrated this activity through animal experimental studies as well as through the clinical trials. So the mode of action can be understood. Next slide, please. So the drug, that is the Saraswata Grit, when we did the phytochemical analysis, so it has presence of the chabulic acid, it has 6 Chagol, piperine, berberine, beta-aceron, piperine, and carotene. So these are known for their memory enhancing properties, and they are proven to have this neuroprotective activity. They have anti-apoptotic activity. They are good in free radical scavenging. They are good antioxidants. And this is how, when the drug is administered through the nasal route, it is a very convenient and easy mode of administration of the drug. At low doses, it can have significant results proven through these scientific studies. So with this, I have come to the conclusion of my presentation, and I thank the organizers for giving me this platform. And I wish everyone to live 100 years and have good memory. So thank you one and all. And I would like to acknowledge the director of the institute, Professor P.K. Prajapati sir, former director, Professor Tanuja Nehsri, Ministry of Ayush, my colleagues from IIT Delhi, from IIT Mandi, Professor Ashok Patel and Professor Lalan Singh, Dr. Shivani Gildyal and Dr. Robin, who carried out this work. Thank you one and all.
Thank you very much, Dr. Pramod. You have very clearly explained how a drug, of course, it is a traditional classical formulation, but still you have followed all the steps of a new drug for analysis, that is starting from the collection of raw drugs to the standardization, quality assurance, and different levels of the safety profile, and finally to the bedside, that is public health initiative project. Thank you very much for giving this very good presentation. The outcome of any research is good quality publications. A couple of publications also you have published in international journals. This is a welcome note, and thank you very much. Going ahead, going ahead with the last presentation or last talk of the webinar is by Dr. Shivakumar Harti. He is an additional professor in the Department of Swasthavrata. Swasthavrata means public health and yoga. And he also leads the Institute's ICAN initiative activities. His research mainly focuses on lifestyle diseases like diabetes, yoga interventions, Ayurveda health assessment, tool development, Prakriti scale development, and such on. He has been associated with the AIIA since 2015, the beginning of All India Institute of Ayurveda, Delhi, and actively contributes to the academic, clinical, and public health programs. Dr. Harti has published several research papers and presented in several national as well as international platforms on preventive health by Ayurveda. A warm welcome to Dr. Shivakumar Harti. And Dr. Harti, the space is yours now. Please continue with your presentation. Healthy aging and yoga, a scientific approach to longevity and functional wellness. Dr. Harti, please. ये तो प्रशांत है. Please unmute. Harti, unmute.
Thank you, sir. Thank you very much. I'll be sharing my slides. Sir, I hope they are visible, sir.
Audible as well as you are visible? Yes.
Sir, thank you. Good morning, everyone. To start with, I would like to thank the organizers for giving an opportunity to interact here on this platform. Respected Director Professor Prajapati sir, Dean Rajagopala sir, Jonas sir, the learner faculty, and the experts from NICU Western City University. Today I'll be talking on the healthy aging and yoga, a scientific and holistic approach to graceful aging. In the previous presentation, Dr. Pramod wished everyone 100 years of life. So to continue with it, aging is an inevitable part of life, but how we age makes all the difference. Healthy aging isn't just adding years to our life, but it's also adding life to our years. According to WHO, by 2030, 1 in 6 people in the world will be over the age of 60. With increasing lifestyle expectancy comes the need for maintaining physical activity, mental clarity, and emotional balance. Yoga, a holistic system, it harmonizes the body, mind, and spirit. And this is increasingly being recognized as a scientific and sustainable tool for healthy aging. However, modern research now validates what ancient yogis have known for centuries, that yoga promotes longevity, resilience, and inner peace. Aging also brings a lot of challenges. As we age, there is loss of flexibility, reduced muscle mass, joint stiffness, balance issues. We have slower metabolism, insulin resistance, hormonal decline, pain and inflammations, emotional and cognitive challenges like stress, anxiety, mood swings. And other than that, we also have lifestyle and social dimensions like feeling of loneliness, isolations, etc. So to talk with one by one, As we age, physical changes like loss of flexibility, reduced muscle mass, joint stiffness, and balance issues become very common. And regular yoga practice addresses each of these concerns. A study by Gonsalves et al. In 2011 showed that yoga significantly improves flexibility and muscular strength in older adults. And yoga also supports cardiovascular health. In one of the studies by Patel et al., published in Indian Heart Journal, it reported that consistent practice lowers blood pressure, resting heart rate, and LDL cholesterol levels. To continue with, pain is another major barrier for healthy aging. A Cochrane review by Kramer et al. Concluded that yoga effectively reduces chronic lower back pain and osteoarthritis related discomfort. These studies show that yoga is not only a gentle one, but also powerful in maintaining physical independence in old age. Regarding the balance, balance is another key issue with aging. One of the study finds that simple yoga postures improve stability and reduced fall risk among seniors. And this it is said that yoga exercise intervention improves balance control and prevents falls in seniors. Continuing with the metabolic and immune health. Beyond physical and mental health, yoga also plays a key role in supporting metabolic and immune functions, which is very crucial for healthy aging. A study by Kramer et al. Published in Diabetes Research and Clinical Practice reported a very significant improvement in glucose regulation and lipid profile among elderly yoga practitioners, indicating better metabolic control. Similarly, Morgan et al. They observed that regular yoga practice it enhances immune markers and even improved vaccine response, suggesting a stronger immune defense. These effects are linked to reduced systematic inflammation and oxidative stress, which together enhance resilience against chronic disease. To say overall, yoga functions as a metabolic and immune regulator, promoting vitality from within. Every muscle, beyond muscles and mood, yoga acts deep on the physiological and even cellular level. Chronic inflammation and oxidative stress, they accelerate aging. Studies published in Psychosomatic Medicine showed that yoga reduces inflammatory markers like IL-6 and CRPs. It also boosts oxidative enzymes like superoxidate dismutase and glutathione peroxidase, which help the body fight free radicals. At cellular level, a research by Ornish et al. Revealed that yoga and meditation practices the increased telomerase activity, enzyme that protects DNA from aging damage. Furthermore, yoga and meditation, they increase brain-derived neurotropic factor, that is BDNF, which supports neuroplasticity, the brain's ability to adapt and form new neural connections. These studies demonstrate that yoga literally shows biological aging at molecular level. Yoga is also often accompanied by emotional and cognitive challenges. Stress, anxiety, mood swings, and memory decline. Yoga, with its meditative and mindful components, acts as a natural medicine for the mind. Several studies show that yoga reduces cortisol, the stress hormone, and enhances serotonin, improving mood stability. In one of the clinical trials conducted in India, it showed that regular yoga and meditation, they improve attention span and executive functions in the elderly. Brain imaging studies are especially fascinating. Research by Gota et al. Demonstrated that long-term yoga practitioners have increased hippocampal volume and cortical thickness, areas linked to memory and linking and learning. Sleep, another pillar of mental health, we call it one of the Trayopasambhas. It also benefits from yoga. In one of the studies, 8-week yoga intervention significantly improved sleep quality and duration in older adults. Thus, yoga doesn't just calm the mind, it rejuvenates the brain. And our health has got lifestyle and social dimensions too. Healthy aging is not only about physical or mental, it's also about living meaningfully. Yoga cultivates discipline, moderation, and mindfulness in daily life. Practicing yoga often leads to better dietary habits, regular sleep, and reduced dependence on stimulants like caffeine and alcohol. Now, these lifestyle changes align with what Ayurveda calls. Now, even group yoga sessions and satsangas, they foster the sense of belonging. They reduce the feeling of loneliness and isolation that are very common in old age. Moreover, yoga builds efficiency, the confidence to manage one's own health. Through this integrative approach, yoga transforms aging into an opportunity for self-growth rather from decline. When we talk about implementing yoga for healthy aging, feasibility and safety are essential considerations. And many systematic reviews and meta-analysis report excellent adherence and very few adverse events makes yoga one of the safest mind-body interventions for older adults. What's more, yoga can easily be adapted to suit all the physical abilities. Though options like chair yoga, gentle stretches, and breathing practices. Even short, consistent sessions of 20 to 30 minutes a day have shown a very good benefits in mobility, mood, and sleep. Being low cost, non-invasive, and easily accessible, yoga merges as a sustainable health strategy that can be integrated into daily life for an elderly population. To summarize, there have been a lot of evidence which demonstrate that yoga has got a multi-dimensional benefits for healthy aging. In physical domain, studies have shown a significant improvement in strength, balance, and pain reduction. In mental domain, studies highlight a better mood regulation, cognitive performance, and sleep quality. At a cellular level, yoga has shown to reduce inflammation and even increase telomerase activity, slowing biological aging. Telomerase activity and cellular aging might be positively modified by a yoga-based lifestyle intervention. Finally, in metabolic and immune domain, studies find that yoga improves blood glucose, lipid profiles, immune resilience. Altogether, these findings reinforce that yoga is not limited to physical fitness, it's also a comprehensive approach to aging gracefully, promoting health at every level of the body and mind. To conclude, this collective evidence clearly shows that yoga enhances physical vitality, mental clarity, cellular health, and social connectedness, the key pillars of healthy aging. It is scientifically validated, cost effective, and globally recognized as a safe and sustainable lifestyle intervention. Unlike conventional therapies that often target one system or the other, yoga nurtures the entire person, body, mind, and spirit. So, by promoting active, purposeful, and joyful living, yoga empowers us to age gracefully with dignity and awareness. Yoga doesn't just add years to life, it adds life to the years. With this, I encourage everyone, regardless of the age, to embrace yoga. It's not just as an exercise, but also a way of life. Thank you. Thank you, Vanessa.
Thank you, Dr. Shivakumar Harti, for a very, very informative and evidence-based presentation. I think from the second slide onwards, every slide had international publication, evidence-based research publications supporting the role of yoga in healthy, not only aging, healthy life, leading our life healthy, adding life to the years. Yes, it is rightly told and it is rightly supported. Thank you very much for your interesting presentation on behalf of the organizers. Thank you, Dr. Harti.
Thank you, sir. Thank you very much, sir.
Now going ahead with we are finished with the keynote presenters or with the speakers today. And to sum up, because we are running late by half an hour, we are supposed to complete our webinar presentations by 12 noon Indian time. But we are running late. We started a bit late, but since the presentations of quality we were watching, I didn't interfere with the presenters. It was very, very interesting session. Gut microbiome to yoga, that is whole health. We had Our session started with the introductory talk by Professor Jonas, the Dean of International Activities of All Indian Institute of Ayurveda, and followed by a very interesting inaugural address by Professor Ravi Chandran, who is Vice Chancellor of Delhi Pharmaceutical University. And it was followed by a talk by our Director All Indian Institute of Ayurveda, Professor Vaidya Pradeep Kumar Prajapati ji, as well as Professor Dennis Chang, two key leaders in this collaborative activities, always giving light and direction to our activities. Thank you very much, sir. And this was followed by 5 scientific deliberations, starting with Dr. Deep Jyoti Bhuyan. Dr. Deep, his activities are well established one. Gut microbiome, particularly postbiotic activity, is his area of interest, and he presented his presentation. What are the activities he is doing in his gut microbiotic lab as well as NICM? What is the scope and what is the strength of NICM laboratories in conducting evidence-based research? Thank you very much, Dr. Deep. It was followed by a presentation by Dr. Prashant Dharmarajan, our faculty from All Indian Institute of Ayurveda, wherein one study was conducted with the clinical intervention and impact of clinical intervention with gut microbiome modulation. This again presented with the evidence-based research findings. Along with that, of course, they have used internationally accepted tools and techniques for the assessment as well as for evaluation of the results. It was followed by presentation by Sara Aladdin, research scholar of NICM, Western Sydney University. She spoke on fecal microbiota transplantation, her experiences and her findings in her doctoral research work. It was a very interesting presentation, giving impetus to our knowledge on the use of fecal, or what we call as waste is not a waste. It can also be used for therapeutic purposes. Thank you very much. The fourth presentation was from Dr. Pramod Yadav, who of course, it's a complete presentation, a development of a product. Though it is a classical product, how a product can be taken from the bench, that is a lab, to the clinics. And this was fortified with the use of this particular product in a public health initiative with a very positive outcome. We are in my Ayurveda pediatrician by profession, and in my practice also I am using this particular formulation, Saraswata Grita, the medicated clarified ghee preparation in cognitive functions in children, both oral route as well as in nasal route. In some conditions, I am using this formulation as an enema also for the higher functions. So it is a very what you call effective classical formulation having wide range of cognitive supporting activities. It was a presentation by Dr. Pramod Yadav. He has used the latest tools like bioinformatic technology, probiotic technology, all those things into the research area. The last presentation was from Dr. Shivakumar Harti, and of course, his presentation was totally based upon evidence-based outcomes of yoga and yoga science in clinical practice. Lot of evidences he has presented. What all the issues we are coming across in the aging process can be effectively delayed, or we can have a better aging with a better outcome. It was the core of his presentation. So we had 5 very informative scientific presentations in this webinar, and very informative presentation in this webinar. Because of the time constraints, we are not taking any question answer here. Of course, you are all open, all participants, viewers are open for asking questions, which we will convey to the speakers, and whatever reply we are getting, we will be coming back to you. My special thanks to National Commission for Indian System of Medicine, Government of India, the President of MABISM, the board. He is with us, Dr. Narayan Jadhav. Very special thanks to him. So I think a very informative webinar we have come across, and we have visualized or participated. Now, formal vote of thanks is also my responsibility to offer with. Before that, I request all participants, please open your videos. We can have a group photograph as a closing remark of the session. Please go to the full screen, all participants. Great, yes, yeah, okay. On behalf of All India Institute of Ayurveda, giving a brief outline of this webinar series, we signed MOU with Western Sydney University way back in 5 years ago. And that day we had decided every year at least one interactive webinar we will organize. And we continued with that. We continued with different topics like oncology studies, mental health, anxiety disorders and on. And this time we selected the topic of gut microbiome for healthy aging. Both are very important topics in the research arena, hot topics in the research arena. And when I proposed this stuff, because every year we are organizing, taking the lead of organizing this alternatively. The first it started with the All India Institute of Ayurveda, then Western Sydney, All India. Now it was the turn of All India Institute of Ayurveda. And when I proposed this topic with my director, Professor P.K. Prajapati ji, as well as director Professor Dennis, both of them gave their consent to this topic, and we are searching for speakers. Dr. Deep was on our roll, and Deep suggested Sara for the dementia or aging component. And from our side, two important research works were there. That is Dr. Prashant Dharmarajan presented, and second one is presented by Dr. Pramod Yadav. And we wanted to add a yoga component also, because every year when you're arranging this webinar, 4 key speakers on research aspects and 1 from the yoga component we are adding. Ayurveda and yoga are inseparable traditional knowledge of India. That is one of the reasons. And Dr. Shivakumar Harti presented it very effectively. So, for organizing this particular program, the role of directors, Professor P.K. Prajapati ji and Professor Dr. Dennis Chang is very vital. On behalf of All India Institute of Ayurveda, as well as the international cell of All India Institute of Ayurveda, I'm very much grateful to them, and thanks to their active participation. And we had a very loose, important personality, Honorable Vice Chancellor of Pharmaceutical University in Delhi, Professor Ravi Chandiran, as our inaugural address guest of honor. He again highlighted the importance and the need of the study on gut microbiome. Our thanks are due to him also. Our thanks again. Of course, if I'm not doing that, it will be a very grave fault from my side to all our respected speakers, starting with Dr. Deep Jyoti Bhuyan, Dr. Prashant Dharmarajan, Sara Aladdin, Dr. Pramod Yadav, and Dr. Shivakumar. Thanks to all of them. Further continuing this, yes, we had a special guest also, though he didn't intervene in the talk and all. We had Dr. Alok Gupta from Indian Institute of Technology, Delhi, a chemistry professor and an academician by profession. He was with us throughout the course of this webinar. Our thanks are due to him also. I also would like to convey my wholehearted thanks to Ministry of Ayush for supporting us in all our activities. I also would like to convey my thanks to senior faculty members of All India Institute of Ayurveda, research faculty, research team of National Institute of Complementary Medicine, Western Sydney University, scholars from All India Institute of Ayurveda, as well as from NICM, who have joined on virtual mode. And also we had distributed or shared the information of this webinar with all our international platforms. The people from Europe, people from Brazil and other countries, East and West, a lot of them, they have joined either through the WebEx platform or through the YouTube platform. My thanks or our thanks is due to them all. If I'm not mentioning the name of 2 persons, Dr. Manisha, who worked right from the beginning in the arranging this webinar, as well as Dr. Varun, who are the backbones of our international activities here. Our thanks to them also, the IT team of All India Institute of Ayurveda for arranging all IT facilities, admin and accounts department of All India Institute of Ayurveda, and the supportive staff of our institute. And finally, my thanks of All India Institute of Ayurveda to all the participants who have joined this particular event from world over, all over the world. Thank you all. With this, we conclude this webinar with the permission of both senior leaders, directors, Professor Dennis Chang as well as Professor Prajapati ji. May I declare the seminar over, sir?
thank you very much, Dr. Rajagopalan, for the great MC-ship. So I'm looking forward to seeing some of you in December, where I will be coming to Delhi to attend the global summit in Delhi.
Welcome, welcome, sir. Our invitation is always open for all our speakers to Sarah as well as Deep. Whenever you happen to come to Delhi, please make it a point to visit All India Institute of Ayurveda. You are all welcome here. Thank you, sir.
Thank you.
Thank you.
Thank you very much.
Good night.
With this, namaste.
Thank you.
Namaste.